This is a comprehensive update to my acne scarring video I shot in 2023. A lot of things have changed since then. A lot of things have stayed the same, but I think it's worth for me to spend some time and go into depth of how I view acne scarring and the results that I've achieved. Of course, you're welcome to look at my lambfacialplastics.com, look at all the photos that I have, but I want to go through my philosophy. So what has changed actually since 2023? The biggest change for me is that I've removed RF microneedle from my menu. It's not that it doesn't work. It does work. I still can do it. In fact, I recently had a lady that just insisted to continue that because she had some good results with it. The reason I've pulled it off the menu, and I still have two machines that can deliver it, is that I feel that it just doesn't deliver what Botox and microsilicone can do. So my two principal methods of managing acne scarring is going to be Botox and microsilicone treatments, but I also do microdose fillers using a hyaluronic acid for specifically one type of problem, which is dynamic lines that can occur. And I'm going to sort of isolate and talk about that separately. And that's also not in my video in 2023, even though I was doing it for general problems with dynamic folds and creases, but there's this specific entity that looks bad that makes, I think, acne scarring look worse, but I don't think it's treatable with silicone because I don't think it's safe or reproducible. So let's dive deep. First, Botox. What is it? I encourage you to go watch my other videos on this. I spent a decade perfecting this, and essentially what it is I have taken Botox, diluted it enough that you get the benefits of Botox of changes in quality of skin and texture and even reducing active acne without the effect of paralysis. So I've been doing this for a decade, but I really didn't understand the power of it, nor did I understand the permanence or what I was doing. So I learned this technique about a decade ago by a Philadelphia doctor who was using photographs that were not even his to show how wrinkles were reduced. I tried that, I got some good results, and turns out the only reason I got good results with that is because it was temporary, where the face was paralyzed, they couldn't move, and so the wrinkles looked better for a short time, but then the wrinkles came back. So I started seeing that despite doing that, even though it didn't work well for wrinkles, I started getting incredibly good results on skin quality. And in fact, I'm actually right now 2 years out from my own injection of doing it for my own skin, and it's still permanent and looks good. Because there's a lot of misunderstanding about Botox. People think it's going to paralyze you, it's toxic, it's short lived, it's not going to do anything for acne scars. How would it do that? All you've got to do is look at people that religiously do consistent high quality Botox in their forehead. What you're going to notice in those individuals is that their texture, pores, tone, color, quality of skin, lesions, everything looks better in the area where there's Botox compared to areas where there's no Botox. I use this photograph in consultation of Michael Douglas, who looks insanely perfect in his forehead, but everywhere else looks horrific because Botox overheals tissues. So what I try to do is separate the part of Botox that can create healing to the skin without the paralysis. And that's taken me multiple stages of treatments. So I found indirectly that it actually manages even active acne. It can reduce active acne without need for Accutane or other chemicals and without the toxicity risk. So I've reduced the dosing through multiple generations of product. My latest generation in 2024 last year is called SuperTox. Essentially what's super about it is I wanted the dosing low enough that it would not impact the smile, but strong enough that it would still create a really favorable result after a single session. And so misotox is a way to create permanent results. And also my third generation, I put an anti-bruise in there. So oftentimes not more than a few days of bruising. So this is a very, very powerful product. When do I use this product in combination with silicone? And can I do them the same day? And what is each one doing? Easiest way to understand it is misotox or Botox is really intended for textural problems, corrugations, color, active acne, abnormal scar tissue, issues with discolorations, hyperpigmentation. It can manage all of those things, including melasma and just rosacea and other damage from sun damage and aging. but it's mainly meant for also pores, texture, everything. So it's everything microscopic to minimal macroscopic to medium macroscopic. When you get to the deep, deep holes, that's where mesobotox does work, but not as effectively as silicone. In fact, today I just treated a lady who's done 3 rounds of mesobotox, I believe 2 to 3 rounds is microsilicone, and it is insanely amazing. And she's done 1 round of the micro filler, which again I'm going to separate that and talk about that separately. So absolutely incredible results with mesobotox for permanent correction. So how is that possible permanent? And that's something that's hard to articulate because I don't know exactly how it does permanence. But they've done double-blind, prospective, randomized, placebo-controlled studies that you can look on PubMed, where they've done split thyroid scars, breast lift scars with mesobotox on one side versus the other, and they have found that it's significantly better scar tissue in the area where Botox is. So Botox molecularly heals tissues, and that's something that people really don't understand. And that's something that I really didn't understand 20, 30 years ago when I started my practice. And I was doing all the things everyone else is doing, subcisions and aggressive laser and dermabrasion. And that fundamental point I actually should bring up again because I haven't talked about it. But in a general philosophical perspective, what makes my results different from everyone else is it's the exact opposite of what everyone else is doing. What everyone else is trying to do, and I like this exact expression. I got this from my patient I was treating today for acne scars. He said, Dr. Lamb, what you said, and I didn't say it exactly this way, but I like the way he says it. He said today, it's like trying to, instead of filling a pothole in a highway, you're trying to level down all of the normal highway down to the pothole. That's exactly what everyone else is doing. They're trying to sand it down, break it down, and lower the whole normal skin to the abnormal hole. And you just simply cannot do that, especially with large holes. So what I do is I level up the holes to be even. So I'm healing the holes rather than trying to destroy the good skin. So it's fundamentally opposite of what other people are doing. And I'm just getting not only better results, but safer results. Especially I can do these results in Black people. I almost had a heart attack when I saw a Black person trying to get some dermabrasion and other things the other day. I just can't believe how dangerous that is. And my treatment is safe in all skin types. We're talking about Hispanic, Asian, Black, it doesn't matter. Both silicone as well as the mesobotox is safe in all skin types, safe in all seasons. You can't do a laser necessarily in the summer that well, but I'm able to do that in all of those seasons. I do welcome you probably to even watch my 2023 video because I can't recall everything I said in that video. So a lot of those are foundational elements and I'm trying to remember all of it. It's a 35-minute video, but I just going through some of the highlights of the important things and trying to bring all of my foundational principles back into this video as well. So hopefully you do watch some of my other videos, but I'm trying to put it all into one in this one. So mesobotox is cumulative. So it takes about a month to see the full effects. And my silicone patients, my acne scar patients, I treat them every single month if possible to build it. Some people say that I can't afford to do every month. They can come at any time. So it doesn't matter when you come in. You come back in 3 months, 2 months, whatever it is, but you got to get out of your mindset that Botox is somehow a every 3 or 4 or 5 month thing. Since it's permanent, every time I'm doing it is leveling up to another level. It is not something that you need to sort of think about maintenance. Now, it doesn't mean it stops aging or hormone damage or sun damage. It doesn't mean that in 5 years from now or 3 years from now, there's not going to be some ongoing worsening that's there. But the foundational element is permanent. What I'm treating with mesobotox is incredible. So every time I do it, it looks better. Natural question people ask me, how many times do you think I need to do this actually? And of course, it depends on two things: severity of the condition. Also if you're using silicone to accelerate the results in the right case, and I don't always use silicone. And also the other component that's involved is, what is your end goal? Sometimes I look at patients, I go, you don't even need another treatment. They go, no, I see improvement. So they're still wanting more. And that's totally fine because I'm never going to hurt them. I'm just going to get ongoing improvement with it. So that is mesobotox in a nutshell. Again, please watch my other videos on mesobotox. Watch my other videos on acne scars. I cannot give you every detail on the mesobotox, but it is to me now the cornerstone because I'm getting faster results than even much faster than silicone. And great for universal problems. So if you come in, I'm almost always going to give you mesobotox as my cornerstone for acne scars, and then I'm going to add silicone if I need to. I do silicone once a month on what I call silicone days. Usually it's a Friday when I do silicone all day for those patients because I have to open that for that set of patients for that day. And it's a monthly thing if you want to. Now silicone, you don't see the results as quickly. It takes a little while to build up to that result, and I always use a bell curve. So oftentimes on the back end, both for mesobotox and for silicone, is you start to taper where you don't see as much impact, and that could be after 5 rounds, it could be after 10 rounds. But some of my patients say, Dr. Lamb, I'm still seeing differences. I want to spend that money because it's worth it to me. You're impacting me. And my usual mantra is I always say safety and efficacy I've got under control in terms of these treatments, but the cost is not cheap and it's not going to be quick. But I'm going to show you after you've wasted tens of thousands of dollars on useless garbage by elsewhere, where they're trying to rip down your normal skin to good results and you've seen nothing or barely anything. I should deliver far better outcomes, far safer outcomes. Now, there's a question: is silicone safe in your treatments? And I always tell my patients, I actually fix silicone almost every single week. You say, well, if you're going to fix silicone every week, how the heck are you still doing this after 23 years in practice? So the answer is it depends who's doing it, where it's being done, and how it's being done, and what product you're using. So oftentimes we see, I think, two cases where silicone can be quite dangerous. One is adulterated product used like motor oil that is not medical grade product done in illegal clinics where there's no physician there. I'm using Silicone 1000, which is a pure grade product from Alcon, and I'm using it off label, which is absolutely legal. Safety is something you have to counsel the physician doing it. Obviously, if you do it poorly, it may be unsafe. So this is not motor oil. This is not like, I hate to say, transgender butt elevations where people are injecting in. They're very, very scary stuff that they're doing. And this is not appropriate, in my opinion. So this is not that level, that quality of product. And it's not macroscopic. So it's not buckets of it put in one time where it can migrate, cause other issues. I've never had a granuloma in 23 years, which is a reaction to the tissues and an infection. So it's technique, it's the product, and it's the location. So you said, Dr. Lamb, you just told me you fix silicone every week. Where are you fixing this? Lips. I have done a few patients. I've had to actually correct my own silicone corrections. The reason is that under traumatic biting of the lip, it can cause problems. Even if you're using high-grade silicone, you can still have issues. So I just will uniformly tell you, do not do silicone in the lips. I stopped doing this about 20 years ago. I think silicone in the lips is rarely a problem, but it can be a problem, even in proper hands. But when it's adulterated product, large macroscopic injections done by an unlicensed professional, of course, that is dangerous. So silicone is very, very safe. Another question people ask is there a risk of necrosis? And the answer is, in my opinion, no. I cannot substantiate it clinically perfectly, but I've never had this. Necrosis means death of the tissues, and you can have that with fillers, but you don't get it with, I don't think you get it with silicone, even post-rhinoplasty, which is another reason I use it for. But the reason is that the actual silicone, when it's microscopically injected, is actually can be smaller than a red blood cell. So the other thing is, Dr. Lam, have you ever had any complications with microsilicone? Yes, not horrible complications, but minor. So I'm putting in tens of thousands of micro injections right into the dermis, which is that very, very superficial layer. And there's a risk that I've had a couple of patients have a little bit of a micro bump. That is not a granuloma. What happens is that if by my injecting like that, I maybe put it too close to the skin, and that's easy to fix. All I've got to do, and I've done it in 2 or 3 patients, I just put numbing cream on. I don't charge them, of course. I take a light hot tip cautery. I go in there, just flatten it, and it's gone. So that is something that can happen, incredibly rare, but it's possible. Even experienced hands like myself. So just so you know that. So microsilicone, in my opinion, is incredibly safe in my hands for the purposes that I'm trying to achieve. It does take longer to see the difference. And in the past, I would treat almost all the acne scars with microsilicone. Today, I'm using it exclusively for medium to larger size scars. Another question people ask me is, can I do them the same day? In the old days, I said no. I've been doing this for years now together, and it really, really is safe and works. So the way that I do it is when you come in, I do the silicone first because I cannot have any change in the way I read the skin. I've got to do that first. And I will do that actually with no numbing cream. And the reason is that can cause distortion. And it usually is not that uncomfortable. And then Botox, believe it or not, I have a lot more injections. So then after I've done the silicone, I put the numbing cream on for 45 minutes. Then I do the meso Botox right after the silicone, if you want them done together. And I've noticed that far better results, far more accelerated in the right candidate. Again, those that don't have deep scars, they just have more superficial, textural, micro issues, they don't even need silicone. Or even if they have moderately large, but not terribly large, I usually tell my patients, look, to save some money, let's see if we can get this done with no silicone. But mesobotox is absolutely my cornerstone to manage both active acne and acne scars and all the other issues that are not related to it. And I like to say, and this is probably a pretty arrogant comment, which is you'll probably get to the point in most cases where people compliment you on your skin as something that you probably never had. You probably think it's your worst feature. That's why you're coming to see me. But it is something that it all of a sudden becomes something that becomes, wow, I'm getting compliments on something that I thought was the worst thing in the world. So I believe silicone is incredibly safe and powerful. But again, I need to see you in consultation, whether you're sending me photographs from from somewhere else, or you're locally. I love to see you. Of course, with no makeup, so I can read how things are going. Now, if you don't live in Dallas, it's going to be significantly more expensive because this is not a one and done thing. I've got to see you multiple times, and I've had patients even fly from Australia for this. But it's expensive. I've got to see them probably 5 to 15 times. This is not do one or two treatments, you're good. But now that I'm doing mesobotox as my primary mechanism, primary method of doing this, I'm getting far faster results where people, even after 1 or 2 rounds, are seeing some changes that are favorable. So I want to end with this with what I call microdose fillers. So microdose fillers are for the linear depressions. What happens is some people, when they smile, especially with acne scars, but also just with general aging, when they smile, they get these deep lines that look like accordion lines. Those lines are not, in my opinion, safe with silicone because silicone can look too bulky when you don't smile. So what I do is I do a microdose hyaluronic acid based filler, and you can welcome to look at my other videos on this subject, but I'll try to encapsulate as best I can. And that can be done also the same day as the other treatments, but the order would be silicone, the microdose filler, followed by Botox if I'm doing all three at the same day, but I don't have to. So when you're smiling and you get these creases, so, well, would I bother to do that? Is that really part of the acne scars? To me, it can be. And the reason why is when the skin is fragmented and you get these multiple creases, it actually exacerbates the appearance of the acne scars, and it may be worth treating. And lady I saw today had only 1 round of that treatment. And even though I always say my mesobotox is not intended to manage linear deficits and my silicone is not intended to manage linear deficits, with 1 round, it almost looked like 3 rounds that I usually use for someone else. And the reason is I believe that there was some molecular healing from the other derivative benefits benefits of the other treatments that I did. But I always try to segregate and say that if you've got linear lines, that I need to treat it. Now, this is not the bulky migratory fillers that you see with these absolutely nasty cheeks walking around town or the insane lips. This is microdosed, and you say, why doesn't that cause a Tyndall effect? And the reason it doesn't cause a Tyndall effect is because of how little I put in per time. And I'm actually healing that dermal etch. Oh, so that's something that will take multiple rounds. I usually split that one longer, 3 to 6 months, and over a period of a few times. When I start to see sustainability past a year, it's, to me, actually permanent. I wanted to mention one other thing is, why do I use silicone? It's a question people always ask me, versus why can't I use hyaluronic acid? I just talked about hyaluronic acid, use it into the dermal area. The reason that I found is that when I'm dealing with a dermal etch that is a static element, when you try to put hyaluronic acid repeatedly into a dermal etch that's circular, it can cause a Tyndall visibility. In other words, you can see a difference in discoloration, like a translucency, and it can lump together. So you want to be very, very careful when you're treating high volumes of hyaluronic acid. It doesn't stack well. And because I cut on so many bad lips with silicone, what I see is I don't see lumps of silicone. I don't see silicone pouring out like a liquid. I just see that there's this grayish tissue or yellowish tissue that represents the silicone that I'm cutting down, and that it looks integrated. So I actually want that tissue integration when I'm doing the silicone. So you cannot remove silicone. So you have to go to a licensed doctor, or I should say a skilled doctor more than a licensed doctor, because a doctor with his license can do silicone, but his question is, can he do it well? Is not going to cause complications. So micro dosing of that is really important, but silicone, when microdosed, doesn't create lumpiness when done well, in my experience of having done this for a quarter century. So I know I haven't covered every single thing that I've ever covered on the topic of acne scars. There's just absolutely so much information. This video is actually about uh, less than 15, or more than 15 minutes shorter than my other video. But I think there's a lot that I've already covered, enough that I hopefully you'll come to see me and I can help you with your acne scars and even active acne.